Hello, welcome to Behavioral Health 107, Mental Health Disorders. This presentation will be covering paraphilic sexual disorders and gender dysphoria. So what are paraphilic sexual disorders? These are abnormal sexual disorders, behaviors, or impulses characterized by intense sexual fantasies and urges that keep coming back. The urges and behaviors may involve unusual objects, activities, or situations that are not usually considered sexually arousing by others. They include exhibitionist disorder, fetishistic disorder, frauderistic disorder, pedophilic disorder, sexual masochistic disorder, sexual sadism disorder, transvestic disorder, and voyeuristic disorder. So, before we get into the meat and potatoes, so to speak, I just want to have a caveat here that being a little kinky is not a mental disorder. So if you like to experiment with handcuffs or feathers or spanking your partner, this does not mean you have a mental disorder. Most people with atypical sexual interests do not have a mental disorder. To be diagnosed with a paraphilic disorder, DSM-5 requires that people with these interests feel personal distress about their interest, not merely distress resulting from society's disapproval. So just because you don't come to work after a good session of being spanked the night before to discuss it in the lunchroom does not mean that you have a disorder. It just means that you're just not going to discuss your sex life in front of your coworkers. You would have to have a great deal of personal distress about it. Secondly, having a sexual desire or behavior that involves another person's psychological distress, injury, or death, or a desire for sexual behaviors involving unwilling persons or persons unable to give legal consent. So, for example, when a person is underage, meaning 9, 10 years old, they cannot give legal consent. Or if a person is being watched and they are not aware that somebody is watching them, they are not giving consent. So if your spouse is handcuffing you to the bed and dripping candle wax on your body and you are consensually doing this, that is just being a little kinky. It is not a mental disorder. So do not panic that you have a mental disorder. So we're going to start off with exhibitionistic disorder. This is a mental health condition that centers on a need to expose one's genitals to other people. And this is typically strangers who are caught off guard in order to gain sexual satisfaction. Individuals with exhibitionism may purposefully arrange to be observed while having sex with other people. Some exhibitionists demonstrate conscious awareness of their need to expose themselves while others do not. So some people will in fact go to an environment where they know they will be seen having sex. So they may go to a hotel which has a balcony on the 4th or 5th floor where they will then proceed to have sexual activity, knowing full well that others can see them having sex. And the idea is very arousing for them. So who are they? Well, men make up the vast majority of the people who participate in exhibitionism. Conversely, nearly all of the targets of exhibitionists are women, underage girls, or underage boys. Usually the behavior begins during the individual's 20s. However, some individuals start exposing themselves later in life or during their teenage years. Roughly 1/3 of all men arrested for sexual offenses in the U.S. are exhibitionists, and anywhere from 20% to half of all of those caught will reoffend and get arrested again at a later date. In order to qualify for a diagnosis of exhibitionistic disorder, an exhibitionist must either experience harm from his or her behavior or inflict harm in some way on others. The main criterion for people with exhibitionism is a feeling of mental anguish or distress that exists separate from any outside social or cultural judgment of exhibitionistic behavior. A person diagnosed with exhibitionistic disorder must engage in exhibitionistic behavior, engage in exhibitionistic fantasies, or experience exhibitionistic urges for a minimum of half a year or 6 months. Risk factors for exhibitionistic disorder include, especially for male exhibitionists, whether they are shy or not, typically feel dominated by women and they resent it. So by exposing themselves to women, they feel as if they are reclaiming their dominance. So a lot of times what you'll see is a man will be sitting in his car and he will roll his window down as if to ask for directions, and he'll beckon a woman over and she'll go over thinking that it's an innocent request, and as she goes closer to the car she'll realize that his stick shift is exposed for the world to see. And she reacts disgusted or appalled or freaks out, and he gets a feeling of satisfaction from that. Male exhibitionists have a fragile sense of masculinity and have an overwhelming need to express their masculinity. They tend to tightly manage their emotions in their professional lives, but be very dictatorial at home with their wife and children. They engage in conventional, even repressive sexual activity with their partner. For example, not even removing all of their clothes when they have sexual activity with their spouse. So what you're looking at here is somebody who is very tightly wound, who really does not express themselves openly, who maintains that very repressed sense of what we think of as the old-fashioned father who doesn't speak much, doesn't express himself, and even alone with his wife doesn't open himself up to her, even physically. In a 1980 longitudinal study, researcher Blueglass found that 7% of exhibitionists were later convicted of contact sexual offenses, including rape. So essentially what this researcher found was that at some point this repression explodes into violence. Because remember, rape is not about sex, it's about the expression of rage and anger. Next, we're going to talk about fetishistic disorder. This disorder refers to individuals who are sexually aroused by an object or body part which is not typically regarded as erotic. So examples would include hair, gloves, feet, shoes, or clothes. Such a focus itself is not considered a disorder unless it is accompanied by distress or impairment. So if your spouse loves your feet or your hair or your shoes, it's not a big deal unless they are experiencing extreme emotional distress or their ability to engage in a relationship with you is impaired because all they can focus on is that particular aspect. Fetishists may use the desired article for sexual gratification in the absence of a partner by touching, smelling, licking, or masturbating with the item. Fetishism is seen almost exclusively in men, and 25% of men with fetishes are homosexual. The average number of men in society who are homosexual is about 10%, So clearly, it is a fairly high number of gay men who have fetishes. This disorder typically emerges at the onset of puberty and waxes and wanes throughout a person's lifetime. Symptoms of fetishistic disorder. There are 3 criterion and 4 variations. So, the 3 criterion: over a 6-month period, the individual has experienced sexual urges focused on a non-genital body part. So, if your husband or boyfriend is focused exclusively on your breasts, that is completely normal and probably the average for most men, and I mean that very lovingly because guys tend to love breasts, inanimate objects or other stimulus, and has acted out urges, fantasies, or behaviors. The fantasies, urges, or behaviors cause distress or impairment in functioning. And that's really the key here, is that men can love, or women even, can love hair, shoes, silk stockings, it doesn't matter. But when it causes the distress or an impairment in the relationship, that's when it becomes a disorder. The fetishistic object is not an article of clothing employed in cross-dressing or a sexual stimulation device such as a vibrator. Variations or specifiers for the diagnosis of fetishistic disorder include the type of stimulus which is the focus of attention, and that includes body parts, non-genital or erogenous areas of the body, for example, feet or hair. This is also referred to as partialism, which is the preoccupation with a particular part of the rather than the whole person. Non-living objects, meaning your shoes or boots, and other, meaning situation or activities, for example, smoking during sex. So how do fetishes develop? And again, what we're discussing here is not necessarily fetishes that end up being disorders, but just fetishes in general also. We focus on classical and operant conditioning. So you think of Pavlov, you think of B.F. Skinner. For example, a neutral stimulus, such as a pair of high heels, are worn by a woman. Foreplay begins and the shoes are removed to the accompaniment of growing sexual desire, which is an unconditioned response. The association between the unconditioned response of sexual desire during foreplay turns the previously neutral stimulus of high heels into a conditioned stimulus. Sex may not be as satisfying, or an erection may not even be possible unless high heel shoes are present. Operant conditioning can occur as the person will experience anticipatory pleasure or reinforcement from the process of coming into contact with the high heel shoes. Risk factors associated with fetishistic disorder. And again, I know I've said this several times already, but just because you like long hair or high heels doesn't mean that you have a disorder. You may just have a fetish. So, if you have a disorder, you tend to be a victim of physical abuse. You tend to have lower educational levels, inpatient admissions to mental health or substance abuse treatment. You tend to have disability or unemployment. You've been involved with the criminal justice system. You have an increased risk of sexually transmitted infections, and criminal behavior may be involved with fetishistic disorders such as breaking and entering to steal articles of clothing or unwanted contact, such as touching a strange woman's feet in public. There even have been cases of men breaking into women's houses, men and women's houses, so they can touch their feet while the person sleeps. And of course, that might be the creepiest thing in the world, is to wake up and have someone touching your feet. Now we're moving on to frauderistic disorder. Frauderistic disorder typically manifests as intense sexual arousal resulting from touching or rubbing against individuals who are non-consenting and may extend to fantasies of touching as well. This inappropriate touching often occurs in public settings, such as on a crowded bus or in a crowded elevator. Individuals who are diagnosed with frauderistic disorder are usually male and their targets are usually female. The symptoms must have been present for at least 6 months, and the patient must experience significant distress or negative impact on functioning. Diagnosis of frauderistic disorder is based on recurrent touching or rubbing of one or more non-consenting individuals on at least 3 occasions and clinically significant distress. So, if you're a gentleman and you like to rub up against your girlfriend occasionally, even if it gets on her nerves, that's not frauderistic disorder, because she ultimately would be a consenting partner in your sexual behavior or experiences. These frauderistic disorder people are doing it to complete strangers. Onset generally begins in late adolescence. Symptoms include sexually arousing fantasies, urges, and behaviors that involve touching and rubbing against an unfamiliar person. Rubbing the pelvic region, penis, or other areas of the body against non-consenting persons in public places for the purpose of sexual arousal and gratification. So, for example, you're in the subway, it's really, really crowded, and there's some guy who just keeps bumping into you, and it's very uncomfortable. So you shift away, and then he suddenly is back up against you. Well, this is where this frauderistic disorder is coming in. It also happens on a regular basis in elevators when there's, space for 10 and there's 15 people and you're all squished in, and this guy seems to be, again, grazing against you. That is, again, this frauderistic behavior. Using the hands to touch an unsuspecting victim in an inappropriate area, such as the breasts, buttocks, or genital region. Fantasies during the act that the frauteur is involved in an intimate relationship with the victim. The acts become obsessive, reoccur, and begin to interrupt normal daily functioning. There is a significant potential for legal consequences, including conviction of and incarceration for sex crimes. Now we're going to transition to paraphilic disorder. This diagnosis is assigned to adults, usually defined as ages 16 and up, who have a sexual desire for prepubescent children, usually under the age of 13. The typical age of onset is puberty. According to the DSM-5, the actual prevalence of paraphilic disorder is unknown, with an estimate of 3 to 5% of the general population. That is an enormous number, and it has been generally, over the last 100 years, swept under the rug. People in the families have been told not to talk about it, and it is not until the 1990s that the conversation has finally been that it's not the strangers who are molesting children, but family members and the friends of family. And finally, people are beginning to understand the mammoth proportions of people who have been molested by family and friends of family. Any behavioral expression of paraphilic disorder is a criminal offense in the United States, Canada, and Europe, as well as most other places in the world. If someone fantasizes about sex with children, they have the disorder, but they have not committed any criminal acts. So, people who fantasize about having sex with a 5 or 6-year-old, they may not have acted on it yet, but at some point when the urge gets so strong, there's a very high chance that they will act on it when the opportunity emerges. Paraphilic disorder is a highly treatment resistant, and rates of recidivism have been estimated to be 25 to 50%. This number, however, is very inconclusive, as the number is more accurately described as 25 to 50% are arrested for child sexual abuse, and an unknown number reoffend but do not come to the attention of law enforcement. Because as I mentioned before, so many people have gotten away with this over the past millennia because it was just not discussed, and people were told to keep their mouth shut when their father or uncle or a friend of the family molested the children in the house. Symptoms of paraphilic disorder. There are 3 criterion. An individual who has had arousing fantasies about, urges for, or behaviors with a prepubescent child or children. B, the individual has acted out these sexual desires or is experiencing significant distress or difficulty as a result of these desires. And C, the individual is 16 years of age and at least 5 years older than the child or children noted in criterion A. Variations include exclusive type, sexual attraction to children only; non-exclusive type, where there is sexual attraction to adults and children; attraction to boys, attraction to girls; and incestuous attraction only, where a person is only attracted to their own children or nieces and nephews. The pictures here on the right hand side, the top picture is that of Jerry Sandusky, one of the Penn State coaches who was convicted of molesting young boys while he was an assistant coach at Penn State. The picture on the bottom is Dennis Hastert, former Speaker of the House of the United States House of Representatives, who was actually convicted of bank fraud when he tried to pay off one of the young men that he molested when he was a high school wrestling coach. So we are not talking about the creepy guy who sits on the corner. We're talking about highly respected, well-regarded individuals in society, and that is the issue. You know, these are not guys that people would tell their children to stay away from. Jerry Sandusky ran a charity for young people. And Dennis Hastert was a high school wrestling coach. So these people are put in positions of authority over children and given unfettered access. So who are the victims of pedophiles? Adult retrospective studies show that 1 in 4 women and 1 in 6 men were sexually abused before the age of 18. Children in low socioeconomic status households are 3 times as likely to be identified as a victim of child abuse. Most children are abused by someone they know and trust, although boys are more likely than girls to be abused outside of the family. And part of that is because boys are generally given more latitude in terms of freedom to go beyond the household area. Just because boys are seen to be able to defend themselves better. A study in 3 states found that 96% of reported rape survivors under the age of 12 knew the attacker. 4% of the offenders were strangers. 20% were their fathers. 16% were other relatives. 10% were authority figures like the coach, teacher, or a priest. And 50% were acquaintances or friends of the family or victim. That is a stunning set of numbers. So as parents, as mothers, as people who want to protect our children, we have to be very aware that it's not the strangers we have to protect them from, it's oftentimes the people who live in our very homes. There are more male than female pedophiles. By some estimates, men perpetrate as many as 94% of sexual offenses against children. Case studies indicate that a cerebral dysfunction may be a contributing or dominant factor of pedophilia, including problems with self-control, extreme urges, and cognitive distortions. Researchers have observed that pedophiles have been arrested report that they were sexually abused as children. Freudian therapists believe that they are engaging in repetition compulsion, in other words, a drive to relive the trauma they experienced. The use of functional MRIs and PET scans have revealed that the abnormalities of pedophiles appear in the frontal and central regions of the brain. In particular, there is a decreased volume of gray brain matter in the central striatum. As a result, the nucleus accumbens, orbital frontal cortex, and the cerebellum are all affected. The accumbens is the central mediator of reward signaling and expectation. The striatum and the orbitofrontal cortex control this reward system. So if we look at pedophilia as a brain disorder, then we have to ask ourselves, if these people have a disease, is it still a crime? Well, then we go back to when we discussed antisocial personality disorder and how many of these people end up becoming murderers and serial killers. And the reality is, if these people are unable to control their urges and unable to manage their impulses, we have to protect the general public. And as such, it is incumbent on the government to protect by incarcerating and protecting the public from people who are going to do this damage. Physical castration of sex offenders was practiced in the United States through 1975, and as of 2012 in 9 states, chemical castration through the use of synthetic estrogen can be used in some states as a condition of attaining parole status. However, even castration may not dissuade a predatory offender, as they will resort to using foreign objects for penetration, watch other individuals perpetrate on a victim, or watch pornographic videos or images. The distinction is that the deviant desires are in the offender's mind, not their body. The most viable option at this time is long-term incarceration and post-release monitoring and supervision through parole or house arrest, if applicable, as this is not available in all jurisdictions. Another option for these predators who are very likely to commit sex crimes again is designating them as mentally disordered sex offenders under sexually violent predator laws, which allows for long-term civil commitment of the offender and is practiced in 20 states as of 2011. In this situation, the offender is confined to a Health and Human Services facility by a judge or jury for an indefinite amount of time. Persons who have been civilly committed must be evaluated each year by a forensic expert who specializes in assessing sex offenders and the estimated risk of reoffense. So what we're essentially saying is, if there's a predatory sex offender, we can put them in a facility forever without them actually committing or recommitting any crimes, because we suspect they may commit future crimes. This may seem barbaric, but when you look at some of these predatory sex offenders, for example, John Wayne Gacy, who was put in jail for molestation, and he was given a 10-year sentence. He was paroled after 18 months, and then he went on to rape and kill 33 more young men. You know, if he had been kept in jail, which was a psychiatrist's recommendation, he may not have killed 33 more young men. So a lot of these things, this is a combination of problems where we are just not in a situation yet to be able to solve or treat these people and protect young people at the same time. Okay, so now we're going to move on to sexual masochism disorder. Sexual masochism disorder is diagnosed in individuals who experience sexual arousal in response to extreme pain, humiliation, bondage, or torture. The masochist will have unrelenting fantasies with urges to be beaten, bound, or humiliated during sex. Average age of onset is late teens. The estimated prevalence is about 6% of the population, with a third being women and 2/3 being men. The diagnostic criteria requires that the patient experience distress, such as shame, guilt, or anxiety related to sexual fantasy, urges, or sexual experiences. People who engage in bondage or consensual sadomasochistic play do not have this disorder because they do not feel shame about their experience. So again, you know, your husband or your wife ties you to the bed with some silk scarves. You have a little, you know, calling each other names, and at the end of it, you untie each other, you have a sandwich, and you go to sleep. That is not a disorder. There's no guilt, there's no shame, everything is fine. With a disorder, there must be distress. Diagnostic criteria include reoccurring intense fantasies, urges, or behaviors involving real acts of receiving extreme physical pain, torture, or humiliation for sexual arousal. It must be present for at least 6 months. It has results in significant impairment or distress in daily life, including relationships, occupational or social functioning, and it may present with asphyxiophilia, which is sexual arousal by asphyxiation or choking. Masochistic behaviors can be self-inflicted, but must be differentiated between injury not for the purposes of sexual arousal. So for people who engage in self-harm like cutting, that's different. The masochist inflicts pain on themselves for reasons of arousal. Cases of severe injury or death do in fact happen. According to Freud, the desire to submit arises from guilt feelings over the desire to dominate others. Type A personality types who wish to give up control to someone else. So these are the kind of people who make decisions 10,000 times a day, and when they enter this space, this head space where they submit to someone else, they don't make any decisions. An individual who feels shame or guilt about their body or sexual desires. So again, somebody who feels so much anxiety about how their body looks, they're going to give it up because somebody controls every aspect of their experience. So when we think about the potential for death in sexual masochism disorder, we have to think of autoerotic asphyxia, which is a specific type of sexual masochism that involves oxygen deprivation by means of neck compression during sexual activity. The most common manifestations of autoerotic asphyxia are hanging ligature or plastic bags. Autoerotic asphyxia can be done with a partner or during masturbation. In some cases, patients use alcohol, drugs, or chemical substances in conjunction with limiting oxygen to enhance sexual pleasure. Autoerotic asphyxia is the leading cause of death directly related to sexual masochistic disorder. Now, the two pictures on the right-hand side, the older gentleman is David Carradine, who was an actor who played in the Kung Fu series back in the 70s and 80s, who was found in Thailand, who had accidentally killed himself through autoerotic asphyxia. And the gentleman on the right, younger gentleman, was the lead singer of In Excess, Michael Hutchence, who also accidentally killed himself through autoerotic asphyxia. So again, we tend to think of people who engage in these behaviors as, kind of freaky looking people, but very normal people are doing these things, or at least normal looking people, and we have to be very aware that the book cover does not always reflect what's inside the book. Moving on to sexual sadism disorder. This is when sexual arousal occurs from the physical or psychological suffering of another individual. An individual will have an intense feeling of sexual excitement when fantasizing about or witnessing another individual undergoing physical or psychological pain. Acts of sexual sadism may occur with a consenting partner or as an assault on a non-consenting individual. Prevalence rates of sexual sadism disorder vary from less than 10% of convicted sex offenders in the U.S. to anywhere from 37 to 75% of individuals who have committed sexually motivated homicide. The sadistic acts performed or fantasized by a person with sadism often reflect a desire for sexual or psychological domination of another person. So, for example, the Green River Killer was a sexual sadist who would stalk his victims and essentially sadistically and brutally kill them and rape them as part of his process. These acts range from behavior that is not physically harmful, though it may be humiliating to the other person, such as being urinated upon, to criminal and potentially deadly behavior, such as beatings, electric shocks, and biting. The sportscaster Marv Albert was famously brought up on charges back in the early aughts or the late 90s for viciously biting his female companion during a sexual encounter that really damaged his career because apparently the bites were vicious. If an individual experiences recurrent and intense sexual arousal from fantasies regarding or behaviors resulting in the physical or psychological harm of others for at least 6 months, with either significant distress or impairment in functioning, or having acted upon these urges with a non-consenting person. So, there are people who engage in sadism in consenting relationships, and that is not a disorder. When people go into a non-consenting relationship, meaning someone is raped, someone is kidnapped and tortured, that is when we get really into the far end of the disorder. The FBI's database indicates that these people, almost always males, start out by collecting pornographic materials that depict sadistic acts, or they may draw ropes and chains on the photographs of models in swimsuits or lingerie advertisements. They then typically progress to following women at a distance, to hiring a prostitute in order to act out the fantasy, and to asking a girlfriend or other willing partner to cooperate with their fantasy. In other words, the severity of the sadistic acts tend to increase over time. Sexual sadism is rarely diagnosed in men over 50, so you tend to see this beginning much earlier in men. Moving on to transvestic disorder, the individual is sexually aroused by the act of cross-dressing as the opposite gender and yet finds the act of dressing and the resulting arousal distressing. So again, there are men out there who do enjoy wearing their wives' underwear to work, and they get home and they are just as aroused as the day is long, and they are ready to go, and they have no distress. They are happy as a clam. That is not a disorder. Transvestic disorder is characterized by at least 6 months of experiencing reoccurring sexual arousal brought on by the act of cross-dressing. People who engage in cross-dressing for arousal do not have this disorder unless they experience extreme distress. Cross-dressing sessions may include as few as one item of clothing, such as an undergarment, or may be as extensive as full clothing, makeup, and wigs or hairstyling. This is often accompanied by patterns of purchasing, wearing, and throwing out cross-dressing clothing in an attempt to quit. Cross-dressing sessions typically leads to masturbation sessions in younger individuals, while older individuals typically delay gratification in order to extend the cross-dressing session. Individuals who are in sexual relationships may engage in intercourse with their partner either during or after cross-dressing sessions. So oftentimes what you'll see is someone who has this disorder, they get drunk or high, they put on their women's garb, they are feeling no distress while they're dressed as with their women's garb, and then after they sober up, they feel that incredible distress and regret. This is where the disorder begins. So who has it and how does it develop? The DSM-5 reports less than 3% of males report sexual arousal through cross-dressing. It is almost exclusively diagnosed in men, and the vast majority of men identify as heterosexual, with only occasional reports of homosexual activity. Signs of transvestic disorder may begin as early as childhood, with cross-dressing play beginning prior to puberty. While the desire to cross-dress typically remains at the same intensity or even continues to grow stronger, the level of sexual arousal typically peaks early in puberty before lessening over time. For some individuals, feelings of sexual arousal are replaced with a sense of comfort and belonging, and may lead to the desire to remain in the feminine role for lengthened periods. Moving on to voyeuristic disorder. Voyeuristic disorder brings sexual gratification when the individual sees other people perform private activities, such as undressing, being naked, and/or seeing people performing a sex act. In certain instances, according to the DSM-5, the target of the person displaying the voyeuristic disorder is aware of the presence of the voyeur and consents to the behavior. However, in most cases, the voyeur purposely acts in such a manner without seeking the consent of the target. Voyeurism is considered to be the most common of law-breaking sexual behaviors. So if you want to put this in common parlance, peeping toms, the guys who look in the windows or keep an eye with their binoculars or telescopes on the windows of all of the people in the neighborhood to see who is getting undressed or having sex or taking a shower. The diagnosis of voyeuristic disorder is made if the behavior, fantasies, and the intense sexual urges cause significant distress or hindrance to social, occupational, or other significant areas of normal functioning. The affected person should have been exhibiting voyeuristic tendencies such as recurrent and intense sexual gratification or sexual behavior from observing unsuspecting targets when they are naked, disrobing, or engaging in sexual activity of any kind for a period of at least 6 months. The affected person is exhibiting stress and is being impaired by these attractions, has sought sexual gratification from observing at least 3 or more unsuspecting targets on separate occasions when they were naked, disturbing, or engaging in sexual activity of any kind. Risk factors associated with voyeuristic disorder include childhood sexual abuse, hypersexuality or an excessive amount of testosterone, substance abuse. Learning theory studies have shown that emotional abuse in childhood and family dysfunction are both significant risk factors. So there are a ton of other paraphilias, but they're more rare. So just some of the rare but not as rare: telephones, scatologia, which are obscene phone calls, which are not as common today as they used to be in the 70s and 80s because of all our caller IDs. Necrophilia, which is our people who like to have sex with dead bodies. Oftentimes you'll see serial killers who enjoy this because it's the ultimate way to control somebody. Partialism, which I mentioned before, which is a focus on a specific part of the body. Zoophilia, which is a sexual urge towards animals. Coprophilia, which is sexual urge or fantasies about feces. In Philadelphia in I think it was the 80s or 90s, there was a man who lived in one of the wealthiest areas in Philadelphia who would pay young teenage men, boys, to poop in pizza boxes. He wouldn't actually engage in any sexual behavior with the boys, but he was collecting their poop and doing God knows what. But it became quite the news story, and to watch the newscasters have to report it was quite entertaining. Clismophilia, which is a focus on enemas and having a person hold the water inside themselves and controlling their ability to evacuate themselves. Urophilia, which is urine or water sports. And stimtophilia, which is piercing, body modification, and tattoos as a sexual experience. So essentially what you should take away from this is if it's a philia, it means that people are experiencing distress about their experience, and it's not just a fetish or a fun thing to do on a Saturday night with your love muffin. So how do we treat paraphilias? Cognitive therapy seeks to change the patient's behavior without analyzing how and why it shows up. It is based on the idea that the paraphilia is the result of conditioning or imprinting. The therapy is not able to change the patient's sexual paraphilia itself, but can only suppress the resulting unwanted behavior. Behavioral therapy is when the patients learn to control their impulse, and just as importantly, to acquire more acceptable means of sexual gratification. Psychoanalysis is when the patient tries to spot the traumatic unconscious experience that caused the paraphilic behavior in the first place. Bringing this unconscious knowledge to consciousness, and thus enabling the patient to work up his trauma rationally and emotionally, shall relieve the patient from his problems. Theoretically, anyway. Patients also can find relief with marital therapy, group therapy, family therapy, and seeing a sex therapist. The patients can be treated with prescription medications, including medications that are aimed at inhibiting the levels of their sexual hormones, such as anti-androgens that achieve their effects by blocking male sex hormones like testosterone or lowering the body's normal level of testosterone production. Also, antidepressants, especially SSRIs, are especially helpful. Anti-anxiety medications like benzodiazepines and antipsychotics. Okay, now we're moving on to gender dysphoria. Gender dysphoria, many of us kind of know as a sex change, but here's the thing. There's a lot more people in the world who act and dress as the opposite gender without actually going through the surgical part of it. So when we look at gender dysphoria, we're not looking at the actual gender reassignment necessarily, but the desire to live as the other gender. Adults and teenagers have a fixation on eliminating primary and secondary gender features and have the thought that they are not being characterized by the right sex. One should realize that individuals who have gender dysphoria do not have a coexisting physical intersex situation. Now, what that means is there are people that when they are born have both male and female sexual organs because there is some genetic anomaly that occurs within the body when mom is pregnant. So a baby could be born with a vagina and testes, or a penis and ovaries. That's an intersex situation. Emotional pain or difficulty is seen in the workplace, dealing with others, as well as in other vital areas of life. The prevalence of gender dysphoria is about 1 in 12,000 for men and 1 in 30,000 for women. So we're not talking about something that's super common, but for the person who's experiencing it, it's very overwhelming. Now, the picture I have on the right, that is Balian Busham. And on the left is the Balian before his sex change when she was competing as a German pole vaulter in the Olympics. After the Olympics, she went through a sex change operation and now she is a man. And as you see on the right hand side, she totally looks like a dude, and you would never know that at any point in his life he was a woman. Individuals who undergo surgical sex reassignment are only an extreme endpoint of a continuum of cross-gender identification or transgender assignment. Prevalence of sex reassignment surgery. 1 per 30,000 adult males seek sexual reassignment. 1 per 100,000 adult females seek sexual reassignment. There is a reported satisfaction rate of 87% when they go male to female and 97% female to male. This, of course, is our most famous gender reassigned person in the world right now, and it's formerly Bruce Jenner, now known as Caitlyn Jenner. Bruce Jenner in the 1970s was the Olympic hero. He won the decathlon, which was one of the most intensely athletic competitions of the Olympics. And he, over the years, had become very famous as a spokesperson. He married Kris Jenner, the mother of the Kardashian clan, and obviously became part of that circus. And now he is part of his own television show, Caitlyn Jenner. But, this is a situation that he's not doing for publicity, because this is a very traumatic situation for most people who go through sexual reassignment surgery. You are challenging and transitioning everything about you, and it really is a huge change in a person's life. So it's not just done for publicity. Symptoms of gender dysphoria. The DSM-5 states that the initial condition for the identification of gender dysphoria in both adults and teenagers is a noticeable incongruence between the gender the patient believes they are and what society perceives them to be. This disparity should be ongoing for at least 6 months and should consist of 2 or more of the following criteria. Noticeable incongruence between the gender that the patient sees themselves as and what their classified gender assignment is. An intense need to do away with his or her primary or secondary sex features, or, in the case of young teenagers, to avert the maturity of the likely secondary features. An intense desire to have the primary or secondary sex features of the other gender. A deep desire to transform into another gender. A profound need for society to treat them as another gender. A powerful assurance of having the characteristic feelings and responses of the other gender. The second necessity is that the condition should be connected with clinically important distress or affects the individual significantly, socially, at work, and in other important areas of life. So again, this is not something that people generally do as a lark. It is something that they go through a huge amount of time, effort, and money, because it's generally not covered by insurance, to do. And to eventually get through all this, and keeping in mind that the satisfaction rate can be between 87 to 97%, that's a pretty high satisfaction rate. Imagine looking in the mirror, and if you're a man and looking in the mirror and seeing a woman, or if you're a woman and looking in the mirror and seeing a man, there is a disconnect. So what causes it? Occasionally, the hormones that trigger the development of biological sex may not work properly on the brain, reproductive organs and genitals causing differences between them. This may be caused by additional hormones in the mother's system, possibly as a result of taking medications and the fetus's insensitivity to the hormones known as androgen insensitivity syndrome. When this happens, gender dysphoria may be caused by hormones not working properly in the womb. Gender dysphoria may also be the result of other rare conditions such as congenital adrenal hyperplasia, where a high level of male hormones are produced in a female fetus. This causes the genitals to become more male in appearance, and in some cases the baby may be thought to be biologically male when she is born. Intersex conditions, which causes babies to be born with the genitalia of both sexes, or ambiguous genitalia. Parents are recommended to wait until the child can choose their own gender identity before any surgery is carried out. Now that's a recent thing. Up until really 2000s, it was generally mom and dad, you just gave birth, you need to decide right now, which caused a lot of problems. There's a wonderful book by Jeffrey Eugenides, I think, called Middlesex, which goes into detail about an intersexed born child. So how do we treat gender dysphoria? There is psychotherapy, which involves psychology and speech therapy and can help an individual with gender dysphoria. Individuals can be taught about self-awareness, confidence needed to handle any issues arising in their daily lives. The support of family members can be engaged through the use of group, marital, and family therapy, which can help in creating an accommodating and encouraging environment. Therapy for gender dysphoria aims to help reduce or remove the distressing feelings of a mismatch between biological sex and gender identity. This can mean different things for different people. For some people, it can mean dressing and living as their preferred gender without ever getting sex reassignment surgery. Additionally, there's hormone therapy, and finally, as we've discussed, sex reassignment surgery. So here are some of the works cited in addition to the textbook and others. So if you have any questions, please feel free to email or text me or leave a comment. And otherwise, I hope you have a fabulous day. Thank you.